Good afternoon, everyone. You're all very welcome today to our webinar on understanding women's health. We'll be looking at the challenges and the pathways to well-being. So I'm delighted to be joined by two guest panelists this afternoon. So hopefully we'll have a very interesting conversation. What we'll do is just give a few moments or so for people to join our webinar this afternoon. So take a moment to get settled and we'll get going shortly. So welcome to those joining. My name is Dr. Susan Brannick. I'm Clinical Director here at Aware, and today we're going to be talking about understanding women's health, exploring the challenges and pathways to well-being. So just before we get into the webinar itself, to share a little bit of information for anyone who's not familiar with our Aware webinars and Aware services more generally. So you can find all the detail about our services on our website, aware.ie. We have a range of services, including counselling, education programs, and the support line and support groups. Certainly have a look at our website for opening hours over Christmas as well, in terms of our support groups, as well as our Solace Cafe. That's for people who might be experiencing stress or overwhelm. In either Dublin or Waterford, we have in-person services there. So you can find more detail on that on the solacecafe.ie. So just to think about our webinar, as I said this afternoon, we're going to be talking about women's health. So as ever, do put the questions in as you think of them. We'll do our best to answer all that we can. We can't always answer kind of individual queries, but we'll do our best to kind of think about the themes that are coming up. So do ask questions if they arise, and if there's anything kind of outstanding after our webinar this afternoon, we'd encourage you to speak to your GP or health professional. Okay, so just to welcome our panelists, I'm delighted to be joined today by Dr. Jillian Doyle, Senior Clinical Psychologist in perinatal mental health, and Dr. Ciara McKenna. So just by way of a brief introduction, I'll invite you to introduce yourselves momentarily. So Dr. Jillian Doyle is a Principal Clinical Psychologist working on the Specialist Perinatal Mental Health team in the Rotunda Hospital here in Dublin. Jillian has a special interest in promoting, safeguarding and optimising the mental health and well-being of women and infants. And then Dr. Ciara McKenna is a skilled general practitioner with a special focus on women's health. Her passion for women's health led her to earn a diploma from the Royal College of Obstetricians. Not sure if I'm saying that right. Ciara, you can correct me. And gynecologist in 2013, along with further qualifications in contraception, menopause from the ICGP. A recognised British Menopause Society menopause specialist. She's earned an advanced certificate from the British Menopause Society and is an active member of both the Menopause Society of Ireland and British Menopause Society. Bit of a mouthful, but you're both very welcome. Lovely to have you on this afternoon. Maybe Jillian, I might just ask you to introduce yourself briefly and then I'll come to you, Ciara, if that's all right.
Yeah, perfect. So hi, everyone. My name is Jillian. And as Susan has said, I'm a psychologist and I work in a specialist perinatal mental health service. And I'm based in the Rotunda in Dublin, and I've worked here since 2020. And the team itself here, which is a full mental health team, has been in operation since 2019. So I work with women throughout the perinatal period. So from their booking visit right up to 1 year postnatal. And I suppose the reason or how I came to work in this area was following on from having my first child. I suppose I became very aware of the big transitions that happen during this really important part of the lifespan. And that was really what fueled my interest. And then for lots of sort of nice serendipitous reasons, the teams were forming around the same time. And so that was how I came to look into joining one of these teams. Before that, I was working in adult mental health for a long number of years.
Great. Thanks, Jillian. You're very welcome. And Ciara?
Yes, hello everyone. My name's Ciara. Thanks first of all to Susan and everyone at Aware for inviting me to speak. So I'm a general practitioner and women's health specialist. So the reason I ended up going into general practice was that I loved kind of having that continuity of care, seeing people at every stage of life and seeing them come back to me. And over kind of years of training, women's health was something that always interested me. And like Jillian, then through my own personal experiences and seeing family and friends dealing with women's health issues, it was just something I became more and more passionate about, and then kind of pursued those extra qualifications. And just last year, although I still work in general practice, I also co-founded a women's health clinic in Bray. So just to kind of provide that holistic care to women at all stages of life.
Yeah, that's great. Yeah, thanks, Ciara. You're very welcome, both of you. And I think it's a real pleasure, I suppose, to be focusing on women's health, and like you both kind of come with specific expertise, but I suppose we'll be thinking today across the lifespan as well, won't we? So certainly to kind of people watching, do kind of put in any questions that you have. And I guess I would say as well, it's also not just for women in terms of our audience. So it might just be for someone, you might want to learn more information about someone you care about or you're supporting. So I guess you mentioned there, Ciara, kind of across the lifespan, and I suppose thinking more broadly as we introduce this topic, if we were to think about different life transitions, you mentioned that as well, Jillian, didn't you? Kind of having a child is definitely a huge one, but I guess there's other kind of time points, aren't there, in terms of adolescence, and maybe that fertility journey for some people, that postpartum period, and then kind of moving into perimenopause and menopause. I often think it stops at that point, doesn't it? Our conversations, we get to the we got as far as the menopause in the last 10 years, and then that's sort of it. Don't really talk about women's health, maybe 60s onwards. So I guess it's trying to think about, I guess those kind of different life transitions, and maybe one model that we've talked about on these webinars before is that kind of biopsychosocial kind of model of how we might understand women's health. And if it's okay, I might start with you, Jillian, just to kind of give a bit of a sense of that kind of biopsychosocial model. So I suppose how we might understand that in terms of women's health.
Yeah, like I think it's a really nice model to think about different transitions within. So of course with biopsychosocial, we're looking at the interaction of our biology, so something like kind of genetics or hormones or temperament with, the psychology, maybe looking at identity or certain milestones that need to be reached. And then, of course, how social factors play into this. And the social factors are everything that's going on in our environment. And we know that these three things interact with one another and can either support well-being or lead to difficulties or challenges, and so in those different sort of areas or transitional points in the lifespan, these can have a big impact. So for example, with adolescence, we know that there's lots of new hormones, or hormones are increasing in the body. And so, for example, during adolescence, people have, their sexuality, their sexual identity is beginning to come to the fore. And that is such a biological transition, but also a psychological transition. And then, of course, alongside that, people are beginning to become much more independent as they move towards the peer group, away maybe from the parents, which of course for parents is such a difficult, thing to see your baby beginning to make these steps towards independence, as the young person tries to grapple with their own identity and beginning to think about who am I and who do I want to be.
Yeah, I guess it makes me think there's kind of similar issues. I suppose there's some talk, and we'll maybe get into some of these more life points in a moment, but thinking about the menopause and adolescence happening in families at the same time, potentially, and the challenges that might bring up. And as you say, Jillian, that kind of there's a biological piece, there's also the social piece, maybe kind of how a family are at talking about distress and change. That's really relevant, as well as the psychological piece in terms of what you yourself bring in terms of your own coping. And I wonder kind of about your ideas on that, Ciara, because I suppose people will come to GP as first port of call, won't they?
Yeah. I think like a GP is kind of first point of contact for a lot of women. And I suppose often we'll already kind of be seeing women at those big kind of life transitions anyway, for antenatal care, coming for contraception prescriptions and so on. And absolutely, as Jillian was saying, there's often biological components to these big transitions and like big hormonal fluctuations. So often when I'm describing kind of perimenopause, which is a hormonal fluctuation, it's often kind of a bit like puberty. We get these hormone kind of roller coaster of hormones, which can lead to increased feelings of anxiety and low mood. but they often, unfortunately and unfairly, often these hormonal transitions, these biological transitions often hit women at times when there is a lot of psychological and social impact. So, we talk about perimenopause, affecting women in their mid 40s. They're caring for teenagers. We know that women are often unpaid carers for elderly relatives in their 40s, 50s, as well as being at the peak of their career. So it's kind of managing and understanding all of these factors that are playing a role and affecting a woman's well-being at that time. And you mentioned earlier, Susan, about kind of we stop at kind of menopause and then kind of forget about women beyond that. I mean, it shouldn't be. I mean, menopause really is the halfway point in life.
Yeah.
We're going to live a large percentage of our life post-menopause. So we also need to be kind of conscious of all the emotional well-being. Yes, maybe hormonal transitions aren't affecting women at that point, but there's a lot of other biological, psychological, social factors affecting them beyond menopause.
Yeah, exactly. So it's helpful to kind of keep that whole lifespan in mind, isn't it? And I guess that's the kind of a consideration that the menopause as an area is kind of as an area of research and interest has really grown, hasn't it? I guess, and also I suppose I was struck by when you were introducing yourself that the teams only started in 2019 in terms of perinatal mental health as well. In terms of, so I guess some of those services are also kind of relatively new.
Yes. So there was a model of care introduced in Ireland around perinatal mental health in 2017, and the first team got up and running in Limerick shortly after that, with the other teams following across the country. So there's currently 6 perinatal mental health teams, which are in kind of the bigger population centres, and then there are specialist perinatal mental health midwives working in the smaller maternity settings across the country. But yeah, we're kind of just out of our own infancy in our toddlerhood. So yeah, with all the kind of trying to, figure things out that comes with that sort of stage of development. And currently there's a revision of the model of care going to hopefully expand the services in response to this sort of growing need. It's that piece of when you build it, of course, people will come, which of course is what we want.
Yeah, no, that's great, isn't it? And I guess the model of care would have psychology in all of those teams. Is that this idea?
Yeah. So there is psychology across all the hub teams at the moment, which, as I said, are in the bigger population centres. But we're really hoping to expand out not just psychology, but all the different professionals, because at the moment, what we're seeing is that the need is much greater than what the services can provide. So really, we're hoping to greatly expand the number of professionals.
Okay, that's really helpful, isn't it? And I guess and there's a reason, I suppose, that psychology is in these kind of services. And I guess maybe, I don't know if you want to speak a little bit to kind of why someone might kind of benefit from seeing a psychologist, or how a psychologist could be helpful in the team in terms of what it might bring for somebody in that stage.
Yeah, absolutely. So I suppose the people that we see coming to the team are either coming with mental health difficulties for the first time. So a mental health difficulty that has come up in response to this, kind of perinatal period. Or some people will have had ongoing mental health difficulties and they will be linking in with the team because the mental health difficulty is showing up during either the pregnancy or the postnatal period. Or people will have had a mental health difficulty in the past, which will have been resolved and then sort of, flares up again because, obviously, pregnancy and the postpartum period bring a lot of sort of challenges. It's a really wonderful time, an empowering time, but also a really challenging time for people. So people come with their, different experiences, and the role of the psychologist is maybe to help the person understand what's going on for them. So taking a real 360 view as to what are the different challenges that are coming, and what from this person's lived experience are the safety strategies that they've developed to cope in life, and maybe in what way are these safety strategies no longer serving them during this period of their life, and then trying to put in place interventions to support that person during the perinatal period. And then I suppose the other piece, the really important piece that the psychologist does is to sit on the team and offer, like a psychological understanding as to what might be going on for an individual who is under the care of the team.
Yeah, it's really helpful, I think. And I guess I'm just thinking as you're talking, so if someone, and I guess maybe firstly to say we know that not everyone will have children, or I guess but maybe this is starting to think about some of the transition points that can be challenging, could obviously come with their own kind of joy and problems, but might kind of pose certain challenges. I guess if someone was in their place at that journey kind of starting, or maybe they've had a mental health problem, I guess as a psychologist, what would you suggest if they were kind of trying to get help in this context?
So is that prior to pregnancy, Susan?
Yeah, potentially, or if they're pregnant and actually feeling maybe they're struggling more than they expected to.
So, it's so great to have someone like Ciara here, because I think the first point of call is often your GP, and, the GP is a great person to do that kind of first line assessment and to try and help a person understand what's going on. Or, hopefully if you've had your GP for a long period of time, you'll know them and they'll know you, and you'll be able to flag things up early on, and they'll be able to signpost to appropriate services. Likewise, if someone has been engaging with a therapist for a period of time, the therapist might be able to say, like as you're moving towards pregnancy, or, in the early stages of pregnancy, what might be the different challenges that you'll experience. And that can then be referred on to the specialist team if both, the individual themselves and the care provider kind of feel that might be helpful. Like I think for people with certain mental health difficulties, maybe like psychosis or a bipolar disorder, there is a preconception counselling service that psychiatry and the specialist services provide, and that can be really helpful just to think about what might be the risks that come up during the pregnancy, and to support people with managing their medication, because I think people can often feel really worried or concerned about taking medication during pregnancy, when actually, and Ciara will speak to this better than I will, but there's loads of really good, safe options for medication management and support. But sometimes it can be really helpful to have a conversation with one of the psychiatrists about that.
Yeah, that's great. Thanks, Jillian. And Ciara, I guess it's you would be in that position, wouldn't you? Certainly if someone's not involved in a specialist service, and maybe it's possible to speak a little bit to that, and kind of how you might support someone in kind of getting the most from their appointment in that respect, or appointments that they're having.
Yeah, in terms of kind of attending the GP, I suppose our role as a GP is to provide a safe and supportive environment. So we want women not to feel judged when they're coming to us. As Jillian was saying, often if people have been attending us for a while, we know a lot about them, we have a relationship, we know their medical history. But if someone is kind of coming to a GP and maybe hasn't been for a while, or is feeling nervous, which a lot of us will feel anxious about going to a doctor, and sometimes we're complete strangers and people are sharing their very intimate kind of feelings and how they're kind of worries with us. Often I think it's a good idea for someone to make notes before they attend their doctor. So to write down what they're worried about, maybe what they've been noticing, even if they're noticing symptoms coming and going, even a bit of a kind of a symptom diary and such, and to bring those notes with them. And if there's something that they're worried about, even if it's Google has told them this, absolutely ask the doctor. We are never going to judge someone if you say, actually, Google's told me this. Is this, case, someone say, well, look, this is what I'm worried. And sometimes there are things that a doctor might have ruled out in our heads, but we actually haven't told the person. So if there's something that someone's specifically worried about, for them to mention it to us so that we can clarify. If you're feeling very anxious about coming to the doctor, bring a family or friend member with you. It can sometimes be helpful to have someone, an extra pair of ears to listen. Sometimes it's hard to take in all the information at once, or to ask questions if you forget to ask them. And if you're feeling as well, it's never to be afraid to check with the receptionist when booking an appointment. Actually, I think I'm going to need a little bit longer with the doctor than a 15-minute appointment. Is it okay for me to book a double appointment? I think all GPs would be happier to know, okay, look, we're going to give it more time to this person rather than feel that we've rushed someone through. And I never want someone to leave a consultation room feeling that actually I didn't get to ask all my questions, or I felt that I was rushed out of there. And the other thing is, never feel that you're under pressure to make a decision there and then. You know, if there's treatment options being offered, if there's referral options, sometimes we're coordinating referrals. You know, if we feel that someone needs maybe more specialist input, like the mental health team or so on, just to go, look, can I think about my options and then can I come back to you about them, or what are my alternative options? Yeah. And another kind of great question often to ask about if we're starting treatment would be, well, how long is that going to take to affect, or what should I expect over the next couple of weeks? Because sometimes different treatment options, if it's medication, might take a number of weeks to work. So it's just so that you're leaving feeling kind of, okay, I've got all my information there. And the last thing I said, because it's one thing that I always like to do, is because I feel like if someone feels that they're informed and they can know where to look and get information, it's often to ask your GP, well, actually, if I want to know more about this, are there any resources that you'd recommend, any websites that you'd recommend? Because it's fantastic that there's more and more awareness being kind of about women's health. And sometimes it can be a bit overwhelming. There's so much information out there on social media, and it's kind of sometimes hard to know, well, where should I get trustful information? What can I trust? So as doctors, we'll often know, actually, look, this website's really good, or this book. So it's kind of just so you can feel that I know where I can go get more information after I've left the doctor.
Yeah, no, that's really helpful, Ciara. Thank you. And I guess, I suppose we've been talking a little bit about pregnancy, but I think what you're describing is relevant to anyone coming in, isn't it? And I guess kind of this conversation today is not just about pregnancy. I suppose we're thinking about different life transitions maybe there as a starting point, with the acknowledgement. Obviously, it's not going to be relevant for everyone, but really helpful, Ciara, to think, so it's, because I didn't even think about that. Actually, you could actually ask for extra time. You could book that double appointment, because some stuff isn't going to fit in the 10-15 minutes, is it? So it needs that kind of exploration. Ciara, in your practice, in terms of the women that are coming in, I guess I know we kind of an acknowledgement that also you're a menopause specialist, but generally, what are you seeing in terms of the challenges and how in them?
I suppose we mentioned earlier the different life transitions. So, you know, in adolescence, I think Jillian mentioned, we're talking about kind of discovering sexuality, and we're, often we'll have young women coming to talk about contraception, and thankfully, I mentioned about perinatal mental health teams we established. There's more funding going into women's health. So we have the free contraceptive scheme now. So women between 17 and 35 don't have to pay for those contraceptive consultations with their GP. So a lot more women are coming in, discussing their options. And that sometimes might bring up elements about mental health, whether it's someone's going, actually, I'm suffering with kind of premenstrual symptoms. So we know it's very common to experience changes in mood or anxiety levels in the time before our period. With PMS, possibly affecting up to 80% of women. It's very varying things. And then, there's the more severe end, is PMDD, which premenstrual dysphoric disorder, and that affects about 6 to 8% of women, where those premenstrual symptoms have a significant, severe impact on daily life. So sometimes when we're discussing contraception, those things will come up. I also see a lot of women about kind of issues of periods. So that might be kind of pain or heavy bleeding. And unfortunately, this is an area where there's been a lot of medical gaslighting, essentially, over the years, of women being told, well, it's normal to have pain during a period, and it's normal for periods to be heavy. But I saw always a kind of the simplistic rule is a period should never stop you from doing something. Not that I want to sound like some kind of ad for always pads or anything, but it shouldn't be. If your period is stopping you from doing things like going to school, going to work, you need, to talk to a doctor about that. So we're seeing those kind of things coming in, and periods affect most women every month. So that's quite a common consultation. And then we have the kind of fertility consultations, women who are starting to try to conceive, who maybe are struggling to try to conceive. We can discuss those and see if further investigation. And often women need support, because it can sometimes feel a little bit of an isolating situation. These are things sometimes we don't talk about a lot, maybe with friends or family members, if women can feel unsupported. And then antenatal care. Most women will will sign up for what's called combined antenatal care in Ireland, where you attend your hospital visits or midwife visits, but you also have visits with your GP for free in between those visits. So we'll have those visits, and then unfortunately we'll have pregnancy loss as well, which unfortunately is very common and can have severe significant impacts on people's well-being. And I suppose women to feel supported and not to feel dismissed in that loss, no matter how early in the pregnancy that the loss occurs. And then we're moving forward into kind of perimenopause, menopause consultations, and then postmenopause, where unfortunately kind of chronic disease kind of starts to kind of play a role. So women are coming about, we know unfortunately arthritis is more common in women, certain pain conditions, osteoporosis, and heart disease as well. So women coming up with that. So that's kind of the whole transition of life, really.
Yeah, it sounds like it's a lot, a lot of maybe not so great things, but I suppose that's the nature of maybe what you're saying, and going back to the kind of premenstrual symptoms. Actually, a lot of this is about the biological side of things not getting in the way. And I suppose as we were talking earlier there, as you mentioned, Jillian, that can really intersect with mental health, can't it? I guess I was just thinking as you were speaking, Ciara, if someone did have a teenager, maybe that is kind of going through adolescence, and maybe you're at that juncture with kind of thinking about contraceptive, and I guess just kind of what you would say as a GP in terms of as a caregiver, or if someone is younger watching this, what's kind of helpful kind of approaching that GP appointment?
Yeah, I think actually even goes kind back before that. I think it's really great to have like open dialogue with our children about periods and so on from a very young age. So they don't feel that it's something embarrassing or they don't want to talk about it. So just having that open dialogue, talking about periods, and we talk about even with young children, if you're walking down through the supermarket aisle and pass them pads or tampons, to comment on them, or or if they ask questions, to answer those questions, because I think it's so important for young girls and women to feel comfortable to go to their caregivers about these issues. That if they're starting to notice, okay, look, actually, I'm not feeling very well, or I find my mood is that, and I suppose not just to talk about the bleeding aspect, but actually maybe to mention to girls at their periods, like, okay, some people find that their mood drops or they feel a bit more sad before their period, and then if you notice those symptoms in a daughter or a young woman that you're caring for, is just to, I suppose, to try and see, look, would you like to go to talk to your GP? Often teenage girls often will come to their first appointment with their mum there, and a lot of them will ask their mum to do all the talking, and that's absolutely fine. And I'll often say to teenagers, look, this might sound like really embarrassing stuff, but this is stuff that I talk about all day long. I love talking about all this stuff, just to put them at ease. It's kind of like, this is normal to be talking about periods, and then it's covering kind of, even we talk about that diary. Look, even to keep a bit of a symptom diary before you go to that doctor's appointment, or kind of look, these days a month I'm not able to go to school because of bleeding or pain. These are the painkillers that I've tried and they're not working. So that's kind of, just before coming in.
Yeah, I think that's really interesting, isn't it? I guess, as you say, it's sort of planting the seed early on in terms of how we might relate to our bodies, how we might understand them, and how we might kind of work through big life changes, whether you have kids or whether you don't. But also that's kind of brought up as a question perhaps for people who don't, or brought up as a discussion a lot of the time. And then potentially moving through perimenopause and menopause, how you might navigate that. And I guess whether if someone's had kind of challenges with their mental health previously, I guess all of those can coalesce in a sense, and then not in a way that can be helped and can be worked through. And I guess I wonder kind of your views on that, Jillian, in terms of, I guess, and maybe one of the reasons for this webinar is that women and men face different challenges, don't they? So there's going to be different kind of, we're talking about the body a bit, but I guess there's also that social piece and what we're seeing and how that might meet low self-esteem or other kind of psychological challenges.
Yeah, and actually, I was thinking as you were talking there that, some of these conversations, we can actually start having them from infancy. And if we can start introducing them from infancy, like introducing children to their bodies, that your body is, a very functional thing, and it's something for pleasure and something to enjoy and something that's just yours, and safety, and conversations about consent, that we can actually start those right from day one. And so that by the time adolescence comes along, we just have those words in our mouths because sometimes like particularly if you've grown up in maybe at a time when things weren't discussed as openly, or in because in certain cultures maybe things are talked about differently. It's just really important that we start having open conversations so that if someone is struggling either with a mental health difficulty, which can sometimes be really difficult to talk about and people might have an experience of shame around it, that people know, well, this is a safe place. My parents or my caregivers or my teacher is a safe person for me to go to and have these conversations, or my GP or my psychologist or whoever it is that people know where to go. But I think that the other piece around maybe something like adolescence is often a time where, because people are really beginning to think about who I am, that then the issues with self-esteem can begin to develop, because then there's this idea of, well, if I'm this person, then I am different from you. And obviously that starts coming up a lot earlier. But I think because the peer group is so important during, pre-adolescence and into adolescence, that people can become acutely aware of feeling isolated or feeling apart from their peer group. And of course, as adolescents, we want to really be part of the peer group. So, people can begin to change their behavior based on what their peers are doing, or to become very self-conscious. And so that can all have an impact on mental health. And, I think we can even see that in earlier childhood, as kids turn kind of 8, 9, they begin to look at their peers and want to fit in, which of course is natural. But as we move more into adolescence, I think shame becomes much more prominent, and that sense of the self-critic becomes more prominent. And of course, that makes a lot of sense from an evolutionary point of view, because humans, we are ultimately pack animals, and we want to be in the pack, because from an evolutionary point of view, if you weren't in the pack, if you were outside of the pack, you had much less chance of survival. So we want to be close to others, and our human brain is primed to make connections with other people. And so of course there can be this feeling of watching yourself among others that becomes really, really important during adolescence.
Mm-hmm. And I guess in adolescence, I think it's probably from when all of us were in adolescence, it's a very different social context now, isn't it? And I suppose some of the research we might know about kind of girls and young women are facing maybe very different challenges. So as you say, Jillian, there's that kind of an individuating out, kind of how your self-esteem might kind of land there, but also the sort of societal challenges that you might be facing, and how they're internalized or not, or how you get support around that.
Yeah, absolutely. And as you say that, of course, the thing that comes to my mind, and maybe to a lot of people's mind, is this idea of, sometimes having a different online persona than who you really are. And that can be so difficult, because then you feel this need to keep up this identity that's been created, and maybe you want to appear a certain way, and then feeling inside that who I really am, I can't show it to people, because then what if they don't like me or they reject me? And I think the really important thing for caregivers to try and support young people with, because of course the online world is important for young people, and we do know that, but it's to try and kind of marry the two, that it's okay to show who you really are, and it's also to try and help young people protect themselves, that not everyone is going to like you online, just like not everyone likes you in real life, but you are still great, and that's okay. It's one of those challenges that that we all need to kind of come to terms with. And I think it's a really hard thing to come to terms with, and something that we just have to kind of I suppose negotiate as we get older.
Yeah, absolutely. And I guess as you were saying there as well, kind of having those conversations more so it's interesting, isn't it? That kind of real version and social media version, and what's real in the mix of that. And I guess that kind of not necessarily only about the menopause care, but I suppose there's been much more conversations about that, hasn't there? I guess, and you might say, well, why are women's health webinars? And I guess we're kind of, in a way, we're kind of taking a quick tour in a sense through some of the issues. We may not get into detail about a lot of them, but I suppose these are the kind of the transition points. But there's certainly more conversation, what it's like to be a younger girl, a young woman, what it's also like to be a woman in perimenopause. These are kind of more societal conversations that are happening that seem to be very helpful, I think, in terms of being able to recognize, I think as both of you alluded to, maybe this is not something to live with. Maybe this pain or this mood change actually isn't right. This needs kind of support or help. I don't know what you think about that, Ciara.
It's fantastic. That there are more conversations happening. There's more awareness. I mean, unfortunately, women's health has always been under-recognized, underdiagnosed globally. I suppose, like, in terms of even medical research, there's only 5% of global medical research funding goes into women's health, and only 1% of that of global funding goes into women's health non-cancer conditions. So it has always been far down the priority list in medical research, in development. So it's great that this is being talked about more. We know, unfortunately, women are more likely to suffer with chronic pain, and we know that chronic pain can have a severe impact on mental health, and mental health can have a severe impact on our perception of pain. So it's just about kind of being aware, like, women and men are very alike. We're also different. We have a different. It comes back to that biological makeup. So we need to be having more of these conversations. And unfortunately, although the conversations are happening, there's been a lot of women who've missed out on this. And these conversations need to keep happening. And yes, we can all get a little bit cynical when Pantene bring out their menopause shampoo. But the more awareness, the more conversations, the more that women who are in need will feel more comfortable to go to their healthcare professional, to talk to their family members, saying, look, something's not right. And I think always we have to recognize we are very good at recognizing when something doesn't feel right, when we don't feel ourselves. And so if we're feeling that way, to talk to someone.
Yeah, absolutely. Whether that's someone like yourself, or someone in a team like yourself, Jillian, or maybe a family member or somebody, but it's about kind of asking for that help. Because I guess even thinking, as we said, more conversations. I hadn't heard about the Pantene shampoo. I don't know if it seems like an interesting way to make money, but I guess there's a lot of talk, and you might correct me on this, Ciara, about, I suppose, someone's facing the beginning of perimenopause or that kind of life phase. There's a lot of initial, but I think for the women who might be five years in, or maybe it's I think from kind of these webinars and kind of people who might contact Aware, there's often questions like, okay, so what now that I'm on HRT, my mood is still really low, still really tired, lots of brain fog. What happens then? It's kind of, there's a lot of education about, okay, this is HRT, this is what you should do, but then not much else maybe. When another question that often comes up is when do I stop it? All these kind of things that are more kind of continuous.
Yeah, we've kind of undoing a lot of the fear about HRT, but it's that kind of, like, you're absolutely right. It's that next step. Well, what happens if I don't feel well with that? Or, I always think it's like sometimes we kind of swing too far. We're like, well, HRT is going to cure everything. Well, it might not. And we talk about the biopsychosocial, there might be psychological, social factors, and HRT won't tackle them. Actually, interestingly, the theme of International Menopause Day this year, which was in October, was actually on lifestyle medicine. So I always say, look, what we eat and what we do impacts our menopause. So in the same way that certain lifestyle factors can worsen menopause symptoms, well, actually certain lifestyle factors can improve menopause symptoms. So the International Menopause Society talked about the 6 pillars of lifestyle medicine. So that was healthy eating, physical activity, mental well-being, restorative sleep, because unfortunately sleep is a kind of insomnia is a really common symptom of perimenopause, and HRT doesn't always work for this, particularly if insomnia progresses into chronic insomnia. And then the other pillars were kind of reducing exposure to risky habits such as smoking and alcohol. We know these will worsen menopausal symptoms. And then interestingly, we talked about kind of support healthy relationships as the final pillar. So having that supportive network around you to go to when you're struggling, or just to have, we know the impact of kind of social relationships for our well-being as well.
Yeah, no, that's really key, isn't it? I guess it makes me think that's probably key to mental health more generally, isn't it? I don't know, Jillian, do you want to say a little bit on that, or
yeah, absolutely. Those are great 6 pillars. Like you could bring them across, every kind of phase of life. But I think certainly in the perinatal period, like again, it's a time of like huge sleep deprivation. In pregnancy because of symptoms at times. And then obviously in the postnatal period, if you don't have a baby who's sleeping, you're not sleeping. And then things like nutrition, oftentimes during the perinatal period, people just aren't, able or don't have the time to maybe eat in the way they'd like. Or sometimes people will say, oh, I've been so busy that I forgot to eat. And then also things like maybe some of the like really good kind of habits you've had have gone out the window because you just don't have time to do the things like connect with your friends or exercise in the way you'd like to exercise. And these can all have a huge impact on your mental health. And, I often think as a psychologist, if I'm meeting someone who isn't sleeping, there's very little, psychological work you can do on zero sleep. Like that's the first thing. Like, how do you get yourself some sleep? It's just so important. Because I think universally when we're sleep deprived, we're just not able to function as well as we can.
Yeah, I think it's a really good point, isn't it? It's hard to kind of do kind of clear thinking, isn't it, when you're very sleep deprived.
Oh yeah, absolutely.
And I guess then I could thinking more generally, maybe Jillian, I'll come to you here, I guess, about the kind of, I suppose maybe anything that we haven't covered in terms of the specific challenges, maybe outside of these transition points, but I suppose, sorry, it's a very broad question in a sense, so it might be hard to answer, but how it is to, I guess we've talked a lot about kind of, these kind of changes in hormones and different life transitions, but I guess if there's specific things that women maybe might be kind of face in terms of challenges and what's helpful, I suppose. I suppose I'm thinking about maybe how helpful it is to seek help and kind of knowing your body. So we've talked a little bit about that. How often we have kind of, and as you said, Ciara, earlier, you kind of know when something's wrong, don't you? So it's kind of, it's then where you go with that. And maybe there's something similar in mental health as well, in terms of we know when we're not functioning maybe as we might have or we might want to.
Yeah. Do you want me to go first, Susan?
Yeah, maybe.
Yeah, perfect. Like I think the thing is, if something, any sort of a mental health difficulty is impacting on your functioning or on how you want to live your life, then it's really important to seek help because, the longer it goes on, maybe then the harder it is to seek help because your symptoms might progress or get worse. And also, if there's something stopping you from asking for help, it's hard. The longer it goes on, that's not going to get any easier. So I think if your mental health is stopping you from living the life you want to live, then it's really important to seek help and seek help early. And that's for 2 reasons. It's to get the help as early as you can. But the other thing is, unfortunately, there are waiting lists. So I think it's really important to just get your name on that waiting list. And it's so much easier to cancel an appointment once you've gotten it than it is to kind of wait until there's nothing else you can do. And then suddenly you find, oh, it's 6 months before I'm going to be able to see anyone. And then, like, I think the other piece, we've spoken a lot here today about like open conversation, but I think when we have people in our lives who we can talk to and have conversations with, it's really important just to say to them, I'm struggling and, I'm struggling with X, Y, or Z, and just to start having that conversation and perhaps to give them permission. If you're noticing anything, will you let me know? Because sometimes if you're really struggling, you might notice it yourself, but someone who loves you might notice it, but they might feel worried about saying it to you. So if you can give them the permission to say, look, Jillian, you need to go and talk to someone, then that might just be the little push. And it might be the mum who's saying to the teenager, and I'll go with you. You don't have to do this on your own. But I think if you're lucky enough to have someone like that in your life, to give them that permission to say it to you, then that can feel really, really supportive. And it's not in that way of, oh, they'll like throwing it in my face if, I'm not kind of doing what I normally do. It's much more in that way of, how do we work on this together?
Yeah, so it's a kind of a collaborative kind of piece, isn't it? So it's probably
Yeah.
for the person who's been given the permission, maybe it's a step
Yeah.
kind of thinking about how they might deliver that. And I guess it
Yeah.
might land differently, different times as
Yeah.
well.
Yeah, and if you are someone, for example, who's had a mental health difficulty in the past, and that might have that mental health difficulty come up again, that you could actually, when you're feeling well, sit down and say, well, this is how I'd like us to talk about it at that time, so that you've had that conversation in advance and the person knows what's the best way to go about it.
Yeah, absolutely. Thanks, Jillian. And Ciara?
I suppose in terms of kind of supports that are available, so we mentioned, look, we often, as a GP, will be kind of first point of contact. But I suppose we also know that there's kind of there are, well, unfortunately, as Judy was saying, there are waiting lists, but the HSE also have a list of kind of resources, kind of some online resources for talking, or there's text support if someone's really struggling. The Pieta House, Samaritans, and so on, and Aware, obviously. But even if there's for certain groups of people, there's also kind of funded counselling. So we know for those who have a medical card, there's counselling in primary care that GP can refer to, or Silver Cloud, which is online cognitive behavioural therapy for people with a medical card. There's also, in terms of we're talking about women's health, for groups of women who have certain medical kind of women's health conditions, they're also entitled to free counselling through the HC. So those who are attending the complex menopause clinics in the hospitals, fertility clinics in the hospitals, recurrent miscarriages, and also anyone who's experiencing a crisis pregnancy, they're entitled to free HSC counselling. So to ask your GP to even be referred to those as well.
Is that GP referral only, or can people get that?
No, some can be accessed directly. So the crisis pregnancy counselling can be accessed through the My Options helpline, but some can be referred by either the GP or the consultant if you're attending one of the hospital clinics.
Okay. Well, that's really helpful. Yeah, thank you. And we can certainly share those links after the webinar. I guess I was just thinking, certainly in terms of our Aware surveys and what we know in the research, is that women tend to be diagnosed more often, don't they, with depression and anxiety. So I guess it's good to have the conversations, and I think it's really helpful to have this kind of webinar, but I guess it's also that the help is there, isn't it? So really helpful to hear those kind of options.
And I also think just to say that particularly in pregnancy, but also maybe at different points, people who've had a history of abuse, or people who've had, a history of any sort of sexual assault, like that can bring up a lot of challenges and can have a real impact on mental health during pregnancy, because, pregnancy is such an intimate experience that even if, you've had kind of past experiences that you've worked through, some of those symptoms can reoccur during pregnancy or in the postnatal period. So there are services, that are specifically going to offer therapy to people with those experiences, like the Rape Crisis Centre, or 1 in 4, or the National Counselling Service for people who have had experiences of childhood abuse. And that's across the lifespan. So really important to have an awareness of those as well.
Yeah, thanks, Jillian. I think that's really helpful, actually. Certainly, because and certainly I would know this from kind of people I've worked with as well. Is certainly that a lot of work has happened around coming to terms with something, but then another life transition can bring up stuff that you weren't expecting. So that's really normal, and can be supported as well. So knowing that support is available, it's not that you're doing something wrong or you're not healed. It's that this life transition, this body change is actually really different, and it's thrown up different aspects. So it's important to acknowledge that, I think. Yeah. I guess there's loads that we haven't talked about. I'm sure we could keep going, but in terms of because we've touched on some of the major life events, and I think the key thing is kind of seeking that support when things are feeling off. I guess maybe as we kind of come to a bit of a close, just thinking around, I guess kind of for maybe I'll ask both of you in terms of thinking the most helpful thing maybe for people to take away with them. And also if someone's wondering about any of we think we've mentioned a lot of resources, but if there's any that we haven't said in terms of things that could be helpful. Maybe I'll start with you, Jillian, and come to Ciara.
Yeah, I suppose the takeaway from me is that mental health difficulties are really normal during the perinatal period. So, up to 1 in 4 women will experience a mental health difficulty during the perinatal period. And also just to say that for like a a not insignificant number of women, maybe up to kind of 20% and even as high as 40% of women, they might actually experience difficulties bonding with their baby. So again, that's a really normal thing to happen during pregnancy, but for any sort and postnatally, but for any of the challenges that come up, there are services there for you to support you. And we're really open to hearing whatever experiences you've had. And so please come and find support, go to, the services that you are linked in with and talk, whether that's your GP or other services as we've discussed. But the support services are there and we're growing in number and hopefully there'll be more of us here soon. And there is a postnatal workbook that the HSE have developed for people struggling with their mental health during the postnatal period. And it's a really nice resource. So I would encourage people to go and have a look at that and even have a look at it during pregnancy, because a lot of the skills that you can use postnatally, you can also use them during pregnancy or across the lifespan.
Great. Yeah, that's great. Thanks, Jillian. We can link to that in the all-in-one email from this webinar. Thank you. And Ciara?
I think it comes back to my point of that if you feel something doesn't feel right, whether that's with mental health or physical health, is to go to talk to someone. And as a GP, we're here to provide support in a non-judgment. We're never going to judge what you have to come to talk to us about. And then about that little bit of preparation before the visit can make the visit so much more productive. So kind of going back to writing down notes, writing down your questions so that you feel that you've got as much out of that consultation as possible.
Yeah, that's great. That's brilliant. Thank you so much, Ciara, and thanks, Jillian, for your time this afternoon. A really nice kind of tour around kind of women's health, and maybe hopefully leaving people with bits to think about. And I think maybe the message from both of you actually is that the challenges are normal. But I guess the other key message is that there is help out there to support in those challenges, regardless of what age you are or what's happening. In terms of your mental health or your physical health, there is specific services. So that's maybe something helpful to bear in mind. It's not all bad, I guess, is the sense. It's also, it's going to be different supports that are available if they're needed. So thank you both for your time, your very generous time and your expertise this afternoon. It's been a pleasure to have the conversation. So thank you both.
Thank you.
Moving on then to the webinar for next month. So we will be back again in January. So that will be the 14th of January, and really trying to look at practical ways to help when someone is struggling. So who knows about kind of people will have different experiences over the Christmas and over the last year or so in terms of supporting people. So this is maybe a good opportunity to think about someone you might be supporting who's struggling with their own mental health. So definitely do join us there. And I guess just finally for me to say thank you to the panel again. Thank you for those watching, and thank you to everyone who's watched throughout the year. It's been a pleasure to host the webinars. Hope they've been helpful. I'm wishing you all a very happy Christmas, and we will see you in January. Thank you very much. Take care.
Thank you. Bye now.